We were talking a moment ago about the racial gap in vaccinations. What can be done to make sure that every community is safe? My guest tonight is Dr. Maya Ragavan. She's a pediatrician at UPMC Children's Hospital. She also researches health equity at the University of Pittsburgh and is a fellow graduate of Northwestern. Dr. Ragavan, thank you for taking some time to provide your insight tonight.
Thank you so much for the opportunity to be here tonight. I really appreciate it.
Of course. My first question for you is, are minority communities being left behind, in your opinion, with current vaccination efforts?
Yeah, absolutely. I think that's such an important question. And I think, yes, I think that, you just showed sort of that disparity data before. And however, we're early on in the vaccine distribution process. And I think if we are intentional and thoughtful, we can make sure that that we combat some of these vaccine disparities and really think about sort of.
Can you tell me a little bit more about addressing? Oh, I'm sorry, you broke up.
Oh, I'm so sorry. I was saying one of the things, can you hear me? One of the things that I wanted to start with early on is the importance of leveraging community-based organizations. So one of the things that has been uplifting during this incredibly stressful time is seeing the amazing work that community-based organizations are doing in and around Pittsburgh, and they're absolutely tireless advocates to combat some of the disparities that we've been seeing. And so I think bringing community-based organizations and their wisdom in early on to the vaccine distribution process is absolutely essential.
Can you tell me a little bit about addressing vaccine mistrust? Why does that mistrust exist?
Yeah, absolutely. So, I'm sure that you've seen data that shows that there are definitely disparities in vaccine trust. And, I think that it is so important for us to remember that the vaccine mistrust is often, especially when we're talking about communities of color, Black and brown communities, is extremely well earned. And I think one of the things that we've been, reflecting on a lot is the importance for healthcare providers, for researchers, for other folks that are going to be distributing the vaccine to move away from, we need to educate Black and brown communities about why the vaccine is safe and effective, to how can we build ourselves up as trustworthy? How can we sort of reflect on and acknowledge history and the fact that the mistrust is rooted in sort of legacies of racism, trauma, both past, present day disparities. And so that to me is absolutely fundamental. And I think one thing that we can do is acknowledge and reflect on the mistrust early on in conversations and not ignore history. So bring history into the conversation.
Are there any strategies in play right now to improve the equity when it comes to vaccination opportunities?
Yeah, definitely. So I think there's a few things when we think about equity. So I think that there's equity in access, and there's also sort of the trust-related equity. So when it comes to equity and access, again, sort of leveraging the knowledge of community-based organizations, we just need to be really careful that we're coming up with an access plan where folks that may not be able to come into health centers can also get vaccinated. So like folks who are elderly, who may not be able to access health care centers. And so the way to do that is really bring vaccine distribution into the community. The other thing that's really important, I think, is to consider those who may not have access to technology, as well as English learners who may have some more sort of challenges with scheduling vaccines and accessing vaccines. In terms of trust, I think it's what I was mentioning before, really acknowledging and reflecting on mistrust and engaging with community-based organizations. The other thing that can be really helpful, I think, when it comes to mistrust is ensuring that community health workers and other trusted members of communities are vaccinated. So one of the things, that UPMC has done, which is wonderful, is include community health workers in the 10% of vaccines that are allocated for non-UPMC affiliated health organizations to community health workers and victim services agencies, because we know that health happens outside of the healthcare system. So, yeah.
Dr. Maya Ragavan, thank you so much. She's a pediatrician at UPMC Children's Hospital and an expert on health equity at Pitt. Thank you again for taking some time for us on your Friday night.